Okay, so last time we talked about carpal tunnel, so specifically the median nerve being irritated at the carpal tunnel in front of the wrist. So we're going to talk today about some other things that will present similar to that, and how we determine if it is something else, and how we diagnose it. So the first one is what's called Pronator Tarry syndrome. So the Pronator Tarry's is a muscle that lies something like this here, okay? It's got two heads, and the median nerve, so it's still talking about that same nerve, can actually poke right between those two heads. And if there's irritation here, then it can present very similar, probably the most similar compared to some of the other things we'll talk about, to carpal tunnel. Probably the biggest thing that separates it from carpal tunnel is the symptoms at night or in the morning don't seem to be as bad with Pronator Tarry. So we're going to find this a lot with our people who really have to use a lot of grip. So our weightlifters, our rowers, assembly line workers, things like that. And so we'll notice right away that they have some automatic tension through the front part of their forearms. But an easy test that we will do is we'll just pressure right over that Pronator Tarry's, close to the median nerve. And we use some light pressure here. We might hold this up to a minute, and if that reproduces symptoms, then we can start to think that maybe there's an issue there, okay? Keep working up the chain here. So there's an area right along the front of the neck here. This is called our thoracic outlet, and it's bordered by our clavicle and actually our first rib, which is right underneath it. And we have a nerve bundle that runs right underneath there. A couple other structures that we do kind of classify in that same TOS syndrome would be your scalene muscles, which are right on the front of your neck, and actually your deep pec minor muscle here as well. So this whole area can be an area of compression for that, for nerves as well. Actually, there's less likely to be irritation on the median nerve with the structure, but we still do check it for those rare cases. Sometimes if we just pressure over those scalene muscles, that can reproduce symptoms, but also too, because we have a nerve bundle along with some vascular structures too, we can actually test those vascular structures by stressing some of those areas and paying attention to what's going on at the radial pulse. And if we see change here, then we start to think that maybe there is some irritation here. So we'll stress both the pec minor and also the scalenes as well, and we see if there's any change along or into the vascular area there, the radial pulse. And then keep working up here. Obviously, we got to consider the neck as well, being an area that can irritate or may look similar to carpal tunnel symptoms. This is not as common as we get close, some of it like the pronator or the carpal tunnel itself, but we do have to consider this as maybe a cause. Some things to consider here: if we do add some compression, that can sometimes make symptoms worse. Pain with neck movement, that can sometimes make some symptoms worse. And then if we distract, that might actually relieve some symptoms. But beyond that, we will also go through and we'll do some neurological testing, because when there's irritation, what's called the nerve root, which is an area very, very close to the spine, it leaves us with some very specific symptoms. So we can actually test areas of irritation at the skin. We can actually test for some loss of strength, and then also some more reflexes will start to diminish as well if that's going to be an area that is causing some irritation there. So that's it for this video here. I think next video what we're going to do is we're actually going to look in how we actually treat some of this stuff here. So look forward to that. Thanks for watching.